Another study that was of interest is a randomized phase 2 study of lutetium PSMA. So lutetium PSMA, small molecule targeting prostate-specific membrane antigen tied to lutetium radionuclide. There's been phase 2 data about this novel combination, novel agent in the literature showing reasonably significant activity. But this was a small randomized phase 2 trial for patients who'd progressed on docetaxel and an AR drug and randomly assigned to get either lutetium or cabazitaxel as a second-line therapy. Cabazitaxel at 20 per meter squared. Now, it's a randomized phase 2, didn't really use conventional sort of advanced prostate cancer endpoints. The primary endpoint was PSA decreased below 50%. It met that goal. Other secondary endpoints are primarily PSA endpoints. The trial is way too premature to look at radiographic progression-free survival. What we saw was that lutetium PSMA was reasonably well tolerated, and it's clearly active. What's important to remember is not so much that this study is going to direct the standard of care, but there is a large phase 3 trial called VISION, which is a trial of lutetium PSMA versus the alternative abiraterone or enzalutamide after progression. That trial has completed accrual, and I anticipate that we'll see data probably later this year, perhaps at ESMO time, whether it's in-person ESMO or virtual ESMO. So if that agent actually proves out, this study will provide some additional data for us to think about how to use it. And just to remind clinicians, this is an agent that's going to be given primarily by nuclear medicine physicians with the obvious concomitant management of medical oncologists. So I thought that was an interesting study. Again, it's not definitive, and certainly it's not a registration trial.